Child with special needs. Today's topic is on Introduction to Child with Special Needs. The objective of this lesson is to help them understand the basic concepts related to the disabilities of the children. And the second objective is to offer comprehensive information about the needs of special children and preventive strategies with regard to disabilities to be able to respond effectively. Special child. Isn't every kid special? So, for every parent, a child is special. But what do we understand by the word special needs? This means any kid who might need extra help because of the medical, emotional or learning problems. These kids have special needs because they might need medicine or therapy or sometimes extra help in school, the other stuff which other kids normally do not need. Sometimes you know some of the kids in your school or class who need a wheelchair, who uses braces when they walk. These are the kids who need special needs. They not only need the equipment that help them to get around, but they might need to have ramps or sometimes they need elevators also. Kids who have illness such as epilepsy, diabetes, cerebral palsy and would have special needs too. They might need medicine or other help as they go about in their daily activities. Kids with sight problem, they might need braille for them to read. And kids with hearing or speech problem would have special needs too. A kid who has hearing trouble might need hearing aids to hear and speech therapy also, since it can be very hard to say words correctly when you can't hear well. Kids with learning problems. Kids with learning problems often have special needs. A kid could have a problem that is not noticeable to all. For instance, someone would have problem with anxiety. Anxiety means worry. But you don't know unless you know the child very well. Privately, their parents, teachers and counselors may be working together to help that child. So, special needs is an umbrella term. That means it is a very vast term under which many will be coming. A staggering array of diagnoses can be wedged. Children with special needs may have mild learning disabilities or profound cognitive impairment. The designation is useful for getting the needed services, setting appropriate goals and gaining an understanding for a child and the stressed family. There are very positive points and negative points about this special needs. We will see them. Special needs. They are commonly defined by what a child cannot do in terms of milestones unmet, in terms of foods banned, in terms of activities that are avoided, in terms of experience that are denied to the child. These minuses hit the family very hard. Some parents will always mourn their child's lost potential and many conditions become troubling with time. Other families may find that their child challenges make triumphs sweeter and that weakness are often accompanied by amazing strengths. What are the different concerns? For example, take two families of children with special needs. They may seem to have a little in common. For example, one family is dealing with developmental delays. They have different concerns than dealing with a chronic illness, which will have different concerns than dealing with mental illness or learning problems or behavioral challenges. That means each need is different from the other need. Medical issues. Children with medical issues may require numerous tests, long hospital stays, expensive equipment, accommodations for disabilities. Their families have to deal with the frequent uncertainties and worries. Next, behavior issues. Children with behavior issues don't respond to traditional discipline. With diagnoses like ADHD, fetal alcohol syndrome, dysfunction of sensory integration, Tourette's syndrome, they require specialized strategies that are tailored to their specific abilities and disabilities. If these strategies are not developed and used, the kids with behavior issues throw their family into a serious problems and they are at risk in the school behavior also. Developmental issues are some of the most devastating for the family to deal with. Changing visions of the future and providing immediate difficulties in caring and educating a child. Diagnoses like autism, Down syndrome and intellectual disabilities often cause children to be removed from the mainstream, and the parents must be fierce advocating to make sure that the children receive the services, therapies, schooling and inclusion they need and deserve. Next comes the learning issues. Children with learning disabilities like dyslexia, central auditory processing disorder struggle with the schoolwork regardless of their intellectual abilities. Parents of the learning challenged kids need to be persistent both in working with their reluctant learners and with the schools that must provide the help to these children when and as needed. Mental health issues. Children problems with anxiety or depression can sneak up to the parents. Their problems with attachment, they may smack them right into their faces. Living with a child with mental health issues can put the family members on a roller coaster ride. These children have mood swings. The parents have to find the right professional to help and to make hard decisions about the therapies, medication and hospitalization also sometimes. What are the other common concerns when coming to the child with special needs? Although very special needs child is different and every family is unique, there are some common concerns that link the parents of the challenged kids, like getting appropriate care and accommodations, promoting acceptance in the extended family, in the school and the community. Parents of children with special needs are often more flexible, compassionate, stubborn and resilient than other parents. Now, having a general understanding of the special needs, now we will look in detail what does the concept mean. Children with special needs. They are those who require special education and related services if they are to realize their full human potential. These children are in need of special education because they are markedly different from most other children in their classrooms or in their community or in their family. They may have mental retardation, they may have specific learning difficulties or disordered speech or language, and sometimes you even find gifted children also, that is talented children. Now, here we will see only the handicapped or disabled children. Now, first we will try to understand the concept of impairment, disability and handicap. What do these terms and how they are interlinked with each other? The terms impairment, disability, handicap, they are broadly understood as in relation with each other. For example, you take blindness. Blindness is an impairment. Because of blindness, the child will have a difficulty in seeing or he may not see at all. That is the disability. Because of this disability, he will not be able to read. That is the handicap. So, impairment, disability and handicap, they go hand in hand. Another example, take deafness. The impairment is deafness. Because of deafness, the child has the disability of not able to hear or he cannot hear at all. Because of this, he cannot ask for directions. That is the handicap of the child. Another example, take a child with a physical disability like a loss of limb. This child has a disabled with who cannot walk or difficult in walking. Because of the disability, the handicap is he cannot climb steps. One more example, mental retardation is an impairment. The disability of mental retardation is he does not know how to wear clothes independently, and the handicap is he will be dependent on others. Impairment can generate a disability which can in turn lead to a handicap. A handicap will often lead to further social and economic exclusion. World Health Organization has defined impairment, disability and handicap as follows. Impairment: any temporary or permanent loss or abnormality of a body, structure or functioning, whether physiological or psychological. An impairment is a disturbance affecting the functions that can be mental, that is memory and consciousness, or sensory and internal or external, sometimes like the head, trunk or the limbs. Disability. Disability is a restriction or inability to perform an activity in the manner or within the range considered normal for human beings and mostly resulting from impairment. The term is used to refer individual functioning including physical impairment, sensory impairment, cognitive impairment, intellectual impairment or mental illness and various types of chronic diseases. Handicap. This is result of an impairment or disability that limits or prevents fulfillment of one or several roles regarded as normal depending on the age, sex, social and cultural factors. It is disadvantage resulting from impairment or disability. Disease or disorder. Something abnormal occurs within the individuals. This may be present at birth or acquired later. This gives rise to changes in structure or functioning of the body. For example, a student in your school may have a disorder known as autism that may be a result of differences in the way the brain is working. After having understood the concept of child with special needs, let's now look into the classification of disabilities. How can disabilities can be classified? Physical disabilities, which can be orthopedic impairment or mobility impairment. Again, in orthopedic impairment, we have arthritis like rheumatoid arthritis or osteoarthritis, that is having pain in the knee joints. Second type is multiple sclerosis, muscular dystrophy, crippling from infections, sometimes infections like poliomyelitis, infantile paralysis, osteomyelitis can lead to the physical disability of the child. Congenital malformations, that is absence of limb or reduced limb function or limb deficiency, absence of limbs or dislocation of joints like the cleft palate can also lead to physical disabilities. Traumatic crippling, sometimes amputation occurs which leads to the physical disability of the child. The second type of disability is neuromotor impairments. Under this we have cerebral palsy, spinal cord injury, spina bifida. Then the next one is the sensory impairment. Sensory impairment means something which has to do with the sense organs. So, as you know, the sense organs are the eyes and ears. So, under the sensory impairment, we have the visual impairment which includes partial or complete blindness, auditory or hearing impairment which also includes the partial or complete deafness. The next type of disability is cognitive impairment or disorder of intelligence. Under this, we have mental retardation, slow learners and Down's syndrome. Neurobiological disability. Under this, we have attention deficit disorder, pervasive development disorder or autism spectrum disorder. Under this, we have autism, Asperger's syndrome, Rett syndrome and childhood disintegrative disorder. Not only this, we have other disorders like the speech and language impairment, where the child will have difficulty in speaking and in their language also. Under this, we have articulation, fluency, voice and language disorder. Under speech disorder, we normally find stuttering, stammering, lisping and voice disorders. Communication disorder, expressive language disorder, receptive language disorder and mixed language disorder come under the common language disorders. And lastly, we have the learning disabilities. Under this, we have dyslexia, dysgraphia, dyscalculia and dysphasia. These are the different types of classification of disabilities. After having understood the classification, let's try to understand the causes of disabilities. So, what are the major causes? Why do these disabilities occur? Let's see. The major causative factors for disabilities include prenatal causes. What are these prenatal causes? As we know, prenatal means before the birth of the child. They include the genetic or chromosomal, infection of the mother, exposure to toxic substances, thyroid deficiency, congenital defects in the brain. The next cause is the perinatal causes, that is during the birth of the child. What are the causes leading to the disabilities? Deprivation of oxygen during the birth, abnormal fetal presentation, difficulties during the process of labor, injury to the brain, low birth weight, breathing problems, severe jaundice as soon as the child is born can also lead to the disabilities in the child. What are the postnatal causes of disabilities? That is, postnatal means after the birth of the child. Infection to the brain, iodine deficiency, metabolic disorders like hypoglycemia, malnutrition of the child, and sometimes environment can also cause disabilities in the child, like lack of love, security, motivation, discipline. They also can lead to disabilities of the child. Now, after knowing the classification and what causes the disabilities, let's see what are the needs of a child with special needs. The common needs of children with disabilities can be classified as normal needs, special needs, and educational needs. What are the normal needs of a special child? They need medical care, immunization, play, education. What can be the special needs? They need special services like physiotherapy, early intervention therapy. They need special aids. For example, if the child is blind or deaf, he needs a hearing aids or braille equipment. And if the child having physical disability, then he may be needing wheelchairs and other mobility equipments. Educational needs. What all come under educational needs? Mainstream education, remedial education, curriculum adjustment, change in the examination pattern, concessions and accommodations. Now, we will see what are the special education or special needs of education for these differently abled children. It is practicing educating students with special needs in a way that addresses their individual differences and needs. Ideally, this process involves the individually planned and systematically monitored arrangements for teaching procedures. They need adapted equipment, materials, accessible settings and other intervention designed to help learners with special needs to achieve higher levels of personal self-sufficiency and success in schools and also in community that would be available if the child were given access to typical classroom education. The common special needs include learning disabilities, communication disabilities, emotional and behavioral disorders, physical disabilities and developmental disabilities. Students with these kind of special needs are likely to benefit from educational services such as different approaches in teaching, the use of technology, specifically adapted teaching area or a resource room. In most of the developed countries, the educators modify the teaching methods and environments so that maximum number of students are served in general education environments. Therefore, special education in developed countries is often regarded as a service rather than a place. Integration sometimes will reduce the social stigma and improve the academic achievement for many students. Students with special needs are assessed to determine their specific strengths and weaknesses. Placements, resources, goals are determined on the basis of students' needs. Accommodations and modifications to the regular program may include change in curriculum, supplementary aids or equipment, and the provision of specialized adaptation that will allow the students to participate in the educational environment as much as possible. The students may need this to help to access the subject matter, physically gain access to the school, or meet their educational needs. Schools use different approaches to provide special educational services to students. They can be categorized into 4 categories. The first one is inclusion. In this approach, the students with special needs spend all or most of their day with the students who do not have special needs. Mainstreaming refers to the practice of educating students with special needs in classes with non-disabled students during specific times. The students with special needs are segregated in separate classes exclusively for students with special needs for the rest of the school day. Segregation. In a separate classroom or special school for the children with special needs. Like they will be taken only the children with special needs. Exclusion. A student who does not receive instruction in any school is excluded from the school. So, after having a understanding of the needs of the special child, now let us see how this disabilities can be prevented. Primary prevention. Primary prevention is the action taken prior to the onset of the disease or disability which will remove the possibility of occurrence of a disease or a disability. Secondary prevention. Action which halts the progress of a disease or disability at its incipient stage and prevents complications. The specific interventions are early diagnosis and adequate treatment. Tertiary prevention. All measures available to reduce or limit the impairment and disabilities and minimize suffering come under the tertiary prevention. What are the general preventive measures? General preventive measures. What are the measures that can be taken to prevent the disabilities of the child? Marriage between the close relatives should be avoided. Avoiding pregnancy during the early ages for the girl, like before age of 18 years. And consulting a doctor before planning pregnancy so that the birth defects can be detected at an early stage, and especially if the woman is having diabetes. Care during pregnancy. The care that has to be taken during the pregnant time so that the child with disabilities will not be born. Avoid hard physical work like carrying heavy loads. Avoiding unnecessary drug and medication. Avoid smoking, chewing tobacco and drinking. Avoid exposure to X-rays. Avoid exposure to infections like illnesses like measles, mumps, especially during the first 3 months of pregnancy. Taking precautions against lead poisoning. Eating a well-balanced and nourishing diet. And taking iron tablets, which is very important. Ensure the weight gain to be at least 10 kgs and taking tetanus injections during the pregnancy period. What care that has to be taken at the time of birth? The delivery must be conducted by a trained personnel, preferably in hospitals where all facilities are available. If a baby doesn't cry immediately after birth, then resuscitation measures should be undertaken at once. The babies who are born premature or low birth weight babies may need neonatal intensive cares. These are some of the care that has to be taken at the time of birth or delivery. Early childhood care, that is after the birth of the child up to 3 years, what care that is to be taken so that the disabilities can be avoided. Do not allow the child's temperature to rise more than 1 or 2 degrees. If the child gets a fit, take him to doctor immediately. Every child should be immunized against all the diseases. Do not allow the child to have too much contact with the paint and other lead substances which can be toxic. take precautions against head injuries and other accidents. Ensure that the child is getting balanced diet. Do not allow the child to use hairpins or matchsticks, which can become an accident to the child and may lose vision or hearing impairment can occur. These are some of the care that has to be taken when the child is in his early years of childhood. Being friendly with the kids who are having the special needs is one of the best way of helping the kids. As you get to know them, they may be able to help you understand what are their likes and what are their dislikes, and you will be helpful fulfilling a very special need that every day you may be making a good friends with a child with special needs. So today we have learned the concept of a child with special needs. A child who has a special needs because of the emotional or health problems or sensory impairments or learning disabilities. Then we have learnt about the classification, what are the different types of disabilities, and we also understood the concept of impairment, disability and handicap. Then we have seen what are the causes, general causes for causing the disabilities, and also we learnt about the preventive measures. And lastly, we have seen how to take care so that the disabilities does not occur in the child. Hope you have understood the lesson. Thank you.